Bhattacharya, director of the National Institutes of Health, recently explained that the federal government canceled millions of dollars in mRNA research contracts due to a lack of public trust in the technology. He shared this perspective during an episode of Steve Bannon's podcast, War Room, and in an op-ed in the Washington Post. Bhattacharya described the mRNA platform as a promising technology with potential breakthroughs in treating diseases like cancer. However, he noted that as a vaccine for widespread public use, especially during a health crisis, it has not succeeded in gaining public trust. He emphasized that no matter how advanced the science is, a platform lacking credibility among the public cannot achieve its public health goals. Bhattacharya's reasoning for the shift away from mRNA technology contrasts with that of Health and Human Services Secretary Robert F. Kennedy, Jr. Kennedy recently announced that the agency would reduce its mRNA vaccine development activities under the Biomedical Advanced Research and Development Authority and cancel $500 million in related contracts. He stated that mRNA technologies funded during the pandemic did not meet current scientific standards, prompting a focused shift to whole virus vaccines and new platforms. In his article, Bhattacharya expressed concerns about mRNA vaccines' ability to instruct human cells to produce spike proteins to trigger an immune response. He argued that the scientific community lacks a clear understanding of where mRNA products remain in the body, for how long, and if other proteins are produced in the process. Scott Hensley, a microbiology professor at the University of Pennsylvania's Perelman School of Medicine, noted that these concerns also apply to vaccines using live but weakened viruses, like the measles, mumps, and rubella vaccine, which are deemed safe and effective by federal health agencies. He stressed that human clinical studies are conducted before vaccines are widely used to ensure safety and efficacy. Bhattacharya attributed public distrust in mRNA to the Biden administration's COVID-19 vaccine mandates during the pandemic. He wrote that science should be communicated with humility, and when public health officials fail to do so, they lose public trust, which is essential for any vaccine platform. A spokesperson for the Department of Health and Human Services did not respond immediately to a request for comment from the Hill.